RFK and Republicans think the USPSTF task force is too woke. This is absolute nonsense. Let's take a look at some of their grade A and B recommendations and you tell me if it's woke. Every time you go to the doctor's office, there's a reason why your blood pressure is checked. It is the leading risk factor for heart disease, which is the #1 reason people are unalived in this country. Should we stop doing that? The number of women being unalived by cervical cancer has drastically gone down over the last 50 years because of cervical cancer screening. Colon cancer rates have drastically increased over the last few decades. Imagine the number of folks who would be unalive today if we weren't actively doing this at the rate that we do. Everyone can agree smoking is bad for you, so talking about smoking and smoking cessation, is that really such a bad woke thing? HIV is very much manageable if caught early with medication. And remember, HIV affects everybody, heterosexuals, homosexuals alike. We've seen an increase in the rate of syphilis over the last decade. Pro-lifers, I thought you would want healthy pregnancies. Hepatitis B screening helps with that. Rh blood typing for pregnant women, that's just really basic for healthy pregnancies. Pro-lifers, I thought you'd want newborns that have come into this world to be checked for any serious health issues. Same thing, pro-lifers, I thought you'd be against neural tube defects, so why not give women folic acid? How is that woke? Gonorrhea and chlamydia have serious health consequences in women. They can lead to pelvic inflammatory disease, make women infertile. I mean, that seems like a very pro-life thing. And all you pro-lifers for the children, for children's health, like, don't you want us to make an effort to make sure children are not smoking cigarettes? That's just the grade A recommendations. There's a whole list of grade B recommendations that are also very strong and evidence-based. Most of it is just questions. It's screening. It's checking for things. No one is forcing people to do anything with these recommendations. None of these recommendations have to do with vaccines or forcing pills down people's throats. The narrative that this USPSTF committee is woke or has an agenda is such nonsense. All the recommendations are evidence-based. It's meant to help everybody. Republicans, Democrats, rich, poor, it doesn't matter. All these things affect everybody in our community. Let's face it, this whole MAHA movement, RFK, and his desire to just do things for the sake of doing it is just misdirected anger at the medical establishment. These folks need to stop raging and let us do our job. We want to take care of everybody equally and well. As I said before, this whole thing is just not just unscientific and nonsense for the reasons that they cite that they're doing this. It just comes off as childish.